Hi everyone, my persuasive speech topic is fibromyalgia. Fibromyalgia is a disorder characterized by widespread of musculoskeletal pain. Fibromyalgia syndrome affects the soft tissues and the muscles of the body. Researchers believe that fibromyalgia simplifies painful sensations by affecting the way that the brain processes pain signals. The symptoms include, but are not limited to, moderate or severe fatigue, sleeplessness or sleep apnea, stiffness upon waking or standing for a long period of time, difficulty remembering and concentrating, abdominal pain, bloating or nausea, and irritable bowel syndrome, tension or migraine headaches, jaw and facial tenderness, sensitivity to one or more of the following: light, noise, odors, medications, certain food, and cold, feeling anxious or depressed, numbness or tingling in the face, arms, hands, legs, and feet, increase in urgency to urinate, reduced tolerance for exercise and muscle pain after exercise, a swelling or a feeling of swelling, but not actually swelling, in the hands and feet. According to the Mayo Clinic staff, symptoms sometimes begin after physical trauma, surgery, infection, or significant psychological stress, and symptoms gradually accumulate over time and, and with no single triggering event. The causes. Investigators are constantly looking at various explanations for the occurrence of fibromyalgia. Some examples are hormones, menopause, results not from a single event. Some doctors believe that the results are not only from a single event, but from a combination of many physical, emotional stressors. Treatment and diagnosis. There is no lab test or no x ray that can diagnose fibromyalgia. Sometimes patients are misdiagnosed, which can delay good treatment. They are misdiagnosed because the major symptoms of fibromyalgia are pain, headaches is one, and fatigue. And this can cause a being misdiagnosed because a lot of diseases and disorders causes pain and tiredness, fatigue. Who gets fibromyalgia? Some interesting studies show that women have approximately 7 times less serotonin in the brain. That may explain why fibromyalgia syndrome, also known as FMS, is more common in women. Women are much more likely to develop fibromyalgia than men. Fibromyalgia affects 2% of the U.S. This is about 5 million or more Americans, in which 80% is women. Fibromyalgia can be hereditary. It's like other rheumatoid diseases. Fibromyalgia could be the result of a genetic tendency that's passed from mother to daughter. Treatment for fibromyalgia. Unfortunately, there's no cure for fibromyalgia. Treatment is geared towards symptom relief, helping fibromyalgia sufferers to lead a normal life as free of pain and fatigue as possible. Researching is dividing into why fibromyalgia occurs and how people with fibromyalgia experience symptoms. It is hoped that in the near future, researchers will be able to tailor more effective treatments towards the symptoms of fibromyalgia. Currently, there are three treatment modalities that have been effective in treating the symptoms of fibromyalgia. No two people are alike, and no one single treatment will prove effective for every fibromyalgia patient. Treatment is trial and error and may involve a combination of therapies and medications. Lifestyle with fibromyalgia. Approximately 50% of people with fibromyalgia have difficulty with or unable to perform routine daily activities. Health Central 2009 according to Health Central 2009, 40% of fibromyalgia patients have to stop working or change jobs. People with fibromyalgia are hospitalized about once every 3 years. According to Marlene Email, author of Fibromyalgia and Female Sexuality, sexual activity is good for fibromyalgia pain. Rather than fibromyalgia pain making you shy away from sex, you should embrace it, captivate it, because it's one of the best treatments for pain. It increases the happy hormones in your brain. They, in return, reduce your pain level. You can work with fibromyalgia. People work with fibromyalgia every day. Most people with fibromyalgia can do almost anything they choose, unless they have physical pain that limit them directly. While there is no cure for fibromyalgia, a variety of medications can help control symptoms. Exercise, relaxation, and stress reduction measures may help as well. For more information about fibromyalgia, call womenshealth.gov at 800-994-9662. That's 800-994-9662. Thank you very much.